BP was high, you know, you should really, really work on that. You know, don't just take that for granted. Most young people, you know, like there was an outreach I was at yesterday. I met like a couple of young people. I met about 2 of them that had a high blood pressure, and one of them had been told before and still didn't do anything about it. Do you get? So just routinely just walk into a hospital and just check your BP, see what's up with it. Then apart from that also, if you start noticing that your urine is more concentrated, even when you take a lot of water, or you start noticing any change at all, or any pains, sometimes there's something we call renal stones. They can also predispose to kidney diseases also. If you start noticing this pain, use everything is still there, you know, it just may be a pointer to kidney diseases. You
mentioned there that, you know, walk into any hospital. How easy is it to find hospitals where you can actually do like a checkup that includes testing your kidney, for example?
Well, we all know our Nigerian situation, and we all know that the health sector has its issues where availability of health centers is really not there. So you don't need to go to a hospital setting to go for routine checkup. At least what is available to most people in the hinterlands are places like, they have places like chemists and other pharmacy shops. I know a couple of them that actually offer the services that check your blood pressure, check your blood sugar, and they also do a vital test called urinalysis. So if you can go into all these places just for the aim of checkup, then I think we'll be in order. Then when you notice anything or these practitioners tell you something wrong, that you have a high blood pressure or sugar, your sugar levels are high, then you can go to a formal hospital setting to seek for medical advice.
How expensive is this sort of a test?
Well, the price ranges are not fixed, but it's something that everybody can afford. At least not more than 1,500 in upper limits.
Okay. Okay, now all of you work with government institutions,
well,
and
yes.
you guys seem scared already. No, you don't own the hospitals, of course. Now I want to find out, like, what is the frequency of people coming in with this sort of kidney issues right now, like today, on the average daily? How many people come in with kidney issues in your hospital?
Okay, well, for me, if I'm to speak for myself, it will be hard to say. I work in a health center, and there we don't have facilities to diagnose and all that. So, but if I were to go by the experience I had in the teaching hospital and all that, the renal clinic sees a lot of patients, as in a lot. You wouldn't believe that a lot of people actually do have kidney issues. A lot of people have to be on dialysis like twice weekly and all that. So it's quite more than what I think it is.
How many patients come into your hospital on the average? And how many are young people?
Okay. In an emergency room, for example, overnight, if you have like 12 patients, you could see 5 that have kidney-related issues. But, you know, some of them have been previously diagnosed. Okay. Maybe, let's say, like 1 or 2 are newly diagnosed. And it's not impossible to find young people. Like, you could find young people every time. You know, there was a call we had, and we had like 2 young guys coming, and that was the first time they were going to be diagnosed with kidney disease. Although they've had all the signs, swollen legs, swollen face, urine this and urine that, but that was like the first time they were going to be diagnosed. So it's here.
That was a case of leaving it too late.
Yeah, that's it.
Okay, now, I've listened to all of you talk now, and I want to suddenly change my lifestyle, but there are certain things, I mean, it's tough for a young person, or even anybody in life, to suddenly stop eating certain things. What are the things that you can eat, and what are the options for, or substitutes for those sort of things that you have to avoid, if there are any? Okay, let's start with the fact that we need to take a lot of water. We are in, like, the sun is, like, really, really high in Nigeria, you know, and so you need a lot of water, because the more water you take, the more it flows through your kidneys, helps to detoxify and move waste out. So that's number 1. Another thing is, even if you can't stop alcohol, reduce it to the barest minimum. And please stop smoking. Smoking affects, like, every part of your body. Do you get? So, like, smoking is, like, really, really harmful. Then healthy diet plays a role. When you take things like fruits and vegetables, they are just helpful. They're helpful in many ways that even science has discovered. To get them fatty things. Another thing that can help in this day and time, which people should now get to know, is to get the right prescription and don't overuse drugs. There's something called like analgesic nephropathy. That means like medications, pain medications, like using a lot of ibuprofen, aspirin, paracetamol. You get is a very, very major cause of kidney disease. But self-medication in a country like this is almost inevitable? I mean, like, you know, a lot of the hospitals, first of all, are very expensive. The ones that are cheap, like the government hospitals, it's almost impossible to get an appointment because all you good doctors are always busy with thousands of people. So it's easy to just walk into a chemist and buy things. And it's a tough country, like you said. So the headache will always be there. The body pains, you're in traffic for 3-4 hours. So you always, you don't have to, but most people always have like drugs and stuff they take for painkillers. What is a way around this sort of thing now? How do we then avoid having to do all of this?
Okay. Now, with the question you've asked me, I also want to throw a question back. Will you want to self-medicate yourself, take medications for yourself, by yourself, and get an immediate relief now, and suffer chronic kidney disease later?
Well, it depends on how painful the chronic is.
So that's the thing. In as much as it's difficult, we just have to try. But to help people that find it difficult to get to a health center, maybe there's no hospital in their towns, the nearest medical center is 2-3 hours away. When you have to take these painkillers, do it with moderation. You shouldn't take more than 3 days, because pain has a cause, and these drugs are not treating the cause of that pain. That is why we advise people to come to the health center to see a doctor. Not because we don't want you to take the medications yourself or we want to charge you for services, but there are actually tests that you need to do to make sure that the cause of the pain is found out and treated.
Yeah, you're saying?
Okay, I want to say something. Another problem, at least from what I noticed, is that a lot of people actually go to the chemist, as they are called, or pharmacists, and they just get drugs. They don't know the names of the drugs they are taking. Yeah. And that's a big problem. Now you come over and you're like, oh, you have this complaint. And I'm like, okay, what drug did you take for? They're like, oh, I just went to the chemist place and they gave me this drug. It is red in color. I'm like, well, I don't manufacture drugs, so how am I supposed to know?
So a lot of this is a problem of regulation, and it all goes back to the government, which is who you all work for.
Representatives.
What others? Is it possible that any sort of illness can actually affect your kidney, like basic things like malaria? I mean, malaria is not basic, but I mean, it's virtually every Nigerian has malaria at some point in their life. Is it possible that things like malaria, typhoid can result in your kidney getting affected over time?
Okay. Well, there's a type of malaria. It's called plasmodium malaria. Okay. It can cause nephrotic syndrome, but that's more common in children. Do you get? So in children, you just find their body swollen, just very, very, really, really marked and all that, reduced urine and all that. That can happen in children, but in adults, it's not so common for you to see malaria cause kidney problem. Do you get? It will cause a lot of other things. May not necessarily just cause kidney problem. But yes, so many diseases cause kidney problem, like diabetes mellitus, like hypertension, and even there's something called glomerulonephritis. That's as a result of maybe previously someone had a sore throat, didn't treat it properly, so eventually can now cause a kidney problem, but not malaria. Well, not malaria in adults.
I had a sore throat last week. I'm trying to
you should treat it properly.
I was going to say, when you said affects kidney, in the context of what we're discussing, we're looking at the chronic cases, but we do have acute cases like malaria. Well, not necessarily malaria, even just something like diarrhea and all that could shut down the kidney temporarily. We have a prerenal failure. All these there are acute cases which we most likely resolve on treatment of the cause. But like for the purpose of our discussion on why people come and they want to do this transplant and all that, for most of these common ailments may not cause a chronic kidney disease that will probably require transplant or dialysis. And that's what we
talking about transplants now, which you mentioned, a lot of people, India is a very fancy place to go to these days for a lot of these things now. Is it that we don't have places to do transplants here, or they are too expensive to perform here?
There are places in this country, in Nigeria, that actually offer services that involve kidney transplants. At least I know of about 7 centers. There is, for the purpose of knowledge, there is St. Nicholas Hospital in Lagos, where we work, Luth. They offer these services. This is in Lagos. Then also in the west, there's Ibadan, the teaching hospital in Ibadan. Okay. There's teaching hospital in Ife. There's teaching hospital in Ilorin. Then there's teaching hospital in Kano and teaching hospital in Maiduguri. These are the places for now that we know. And I know that Port Harcourt, where I come from, is also in the process. In the next few months, couple of months, they will also do their kidney transplant. So these centers are there. But you know, Nigerians, we, for whatever reasons, we have this notion that over there it's cheaper. That's why many people rush out there to do it. And there's this thing that we always feel that it's better off anywhere but Nigeria. So
is the death rate here high? Is that why people go away? Is the death rate high with transplants here?
Well, death rates with